This is the labral tear. Here's my probe pulling up on the labral tear. Now we're behind the labrum. We're making space between the labrum and the capsule. It exposes the acetabulum, the rim of bone behind it to the socket. Here we're taking down some of the tissue to get down to the socket in order to repair the labrum down to the bone. This is called a burr, and we're using it to freshen up the bone to get down to bleeding surface, but also remove some of the impingement behind the labrum. Once we do this, we make sure everything's flat and smooth, so you have a nice flat surface, not only to prevent impingement, but also to have a nice flat surface to have healing of the labrum once we fix it down to the bone. We are a bit meticulous during this part in order to ensure that everything is nice and smooth. Once we have a nice smooth surface, we remove all the bone dust that you see coming up from around the burr. And again, we're going, in this particular example, from the front of the hip towards the back or to the side of the hip in order to have a nice round, smooth region for the socket. There you can see the bleeding bone, which allows for better healing. It also helps assess how deep we want to take down the resection. Again, just a different view showing the resected bone and how we're smoothing it out.